and a warm welcome to all of you. And I'm really happy to be part of this workshop or the webinar workshop, and also to work with my very good friend Gominda on this one. So we have 2 hours, and as faculty developers, medical educators, we want to walk the talk. So this is going to be a little bit interactive, and hope that you will enjoy this webinar and also hopefully learn a few things about how to maintain quality and quality assurance in health professions education. So let me first try to upload my slides, and then I think, oops, what happened? Share. Okay, so our focus today is how do we ensure quality in health professions education. Basically, we'll try to define quality and why quality in higher education, especially in relation to medical and health professions education. We will also discuss the characteristics of good quality processes. What are the best practices, internationally accepted benchmark best practices? We will also discuss some of the challenges and limitations, and also we would like to share with you what are the current evidence with regard to this, as well as future trends in quality assurance and why is it important basically in medical education and health professions education, especially to a country like Sri Lanka. Our webinar will focus first, we will focus on quality, what is defining quality in education, and then we will move on to the discussion where we do a little bit of hands-on work, right? And so we are going to get you engaged, and I'm going to use my university's Poll Everywhere interactive platform. All you have to do is that you have to have internet. You can use your cell phone or your laptop and interact. But I do encourage all of you to get involved, because then only we can actually have a very good webinar here today. And then lastly, we will then focus on what are the current trends and why is it that this is becoming very important and crucial in the global stage. So to start off with, we want to get to know a little bit about yourself. So you can see that on top, you have a website, right? So you just have to type in polleb.com/Dujipa to your web browser, and then try to answer this question. You will see on your web browser this particular thing. You can be anonymous. We won't be able to see who's saying what, so it is very anonymous, or else you can say your name, but it is an anonymous platform. So just type in this Poll Everywhere website, and then give your answer. So this is going to be interactive. So we are going to ask you some questions along the way, and you are going to get engaged. Otherwise, it's not going to happen. Or else I'm going to ask my friends, whom I can see some of you in the audience. I'm going to ask you to unmute and share your thoughts as well. Right? Okay. So if someone, I think Vasana or Rikas could just copy paste the website on top, pollev.com/Dujipa. Then they just have to click on that to the chat box. Okay, I can see one person have already responded from medical side. Okay, all right, great. I'm going to leave it here for a little bit more. We have 4 respondents. I can see that we have close to about 46 participants. Anyone else who would like to? So keep that website going, because we will be asking more and more questions. Right? Okay.
Some are replying on the chat. So if you can type in or just copy the website that I have posted and then mark your answer there, then it will get registered.
Yes. So I can see already 5 people already on the website.
If you go,
so out of the 5 people, 3 are from medicine, and I think 4 are from medicine, and 1 person is from nursing. Gominda is the one who can do calculations. Just because I was not very good in maths, I did medicine. All right, so I think 5 people have already given their answers. But then again, I want all of you to go in and engage through the website, because that's the one that we will be using. So I think we have kind of, I see a lot of on the chat also, quite a number who have put A. So that is, they are from nursing. And then I think the others are from medicine. If there are any from physiotherapy or allied health, pharmacy, just shout it out. Just unmute your mic and say you are from the different professions. Okay, so I can see almost all who have kind of, submitted their answers are from nursing or medicine. Okay, all right, good. I think a lot more people are getting onto the platform. That's great. Just keep on getting, don't turn that off, because we will be using that platform again and again. Okay, all right. So the next question I'm going to ask you. All right, so we have most of them are answering. All right, so basically, what do you do in health professions? Do you teach at a university? Do you teach at a nursing school or allied health school? Or are you involved in teaching medical, nursing, or allied health students, but not directly attached to a university or a school? Are you an administrator? Are you purely a clinical practitioner? Or none of the above? Or some of you don't know why you are here. You just accidentally clicked on a website and you are in this webinar. That's also all right. You can listen to Manike Mage Hite, the latest hit song, if that is the case. No need to be here. All right, we have already 5 people. So most of them you teach at a university, or you are from a nursing school or an allied health training school. Okay, good, right? So when I was asking this, I'm not going to show this video, short website. I was asked to do this both in Sinhalese and in English, right? Singlish. So Gominda and myself, we are doing this in Singlish. But Singlish is very, has a different meaning, because in Sri Lanka, Singlish means using Sinhalese and English. But if you say that in Singapore, Singlish is also Singaporean English. Or Malaysia, it is the Chinese English, right? The Singaporeans use. So it's very different. And this website is very nice. It will show you what Singaporean English is. I'm not going to go there because we are a little bit behind time. So I want to ask you whether it is okay if we conduct this both in English and Sinhalese. So I just want to get an idea how many of you are proficient and communicate well in Sinhalese. How many of you are somewhat proficient, and how many of you cannot understand Sinhalese at all? Okay, I have about three people already said that they can fully understand and communicate well. Okay, great. Almost all 8 who have managed to get onto the platform says that they can understand and communicate well. Somewhat proficient, but can't communicate well. Okay, that's fine too, right? Yes. Okay, great. We have 10 people now. That's progress from the very beginning, right? So out of 54, 10 people managed to get onto the platform. Hopefully the numbers will go up soon. Right. The next is that this is an open-ended thing. So you can just type your answer. Why are we all here? What's the central mission of training our medical students, nursing students, pharmacy students, allied health students? Why are we doing that? What's the central mission of health professions education? Excellent. To improve the quality of healthcare provision. Brilliant. Absolutely. So I think the central mission is to improve the quality of healthcare, right? Excellent. Anything else? Any other comments? Any other thoughts? Improve the quality of service delivery. Okay. Any other thoughts? So I'm seeing this word coming out again and again, quality, right? The quality of service delivery, quality of healthcare provision, right? So we are already talking about quality now, right? They ensure the best possible care provided to the healthcare seeker or the person, our patients, our communities, etc. Absolutely. So our focus is basically how to deliver good quality care to our patients, our communities, and also even beyond, when we engage. Excellent. I love the comments are coming up to enhance the health of people by providing quality healthcare. Again, the quality comes out, right? Identify gaps and fulfill the needs through proper education for the entire fraternity. Good. So that's another angle that we are looking at, why we are providing this. Great. So let's move on to this, right? So identifying the gaps. So these are excellent kind of things. So you're absolutely right. And how can we do this? We are doing this through education, right? We are doing this through our training programs. So to improve the quality of healthcare, and this is what Bly and Parcel actually shared in the seminal paper they wrote at the turn of the century, that to improve the quality of care delivered by doctors, nurses, and other healthcare professionals, that we need to get our quality of our education just right, right? Because if we don't provide that good quality education, our graduates cannot practice and deliver that quality care that is necessary. So that is why it is important, and we're talking about quality all the time, right? So now we are talking about quality. Now let's take a step back. In just one word, can you describe the graduate that you want to see graduating from program? What kind of a graduate that you want to see graduating from your program? Just one word. You can say competent, caring, compassionate, anything, right? Just in one word. So basically what we are looking is, who do we want to see? Okay, a physician, a person with compassion. Okay, a person with compassion, right? Anything else? Competent. Excellent. Okay. Okay, I can also see on the chat some humane, right? So someone has typed humane. So you can see that this is a word cloud. The more words that you put the same words, it becomes bigger and bigger and bigger. So you're saying that committed, yes, committed, caring, satisfying. I can see some words on the chat as well. So yes, so all this, right? You are looking for a competent, compassionate, caring, efficient healthcare practitioner, right? Who can adapt, I can see, who is empowered, right? So how do we do this? Will they just automatically be this at the end of 5 years or 4 years or 3 years or 2 years of training? No, right? We need to ensure that our training program actually get all those things into that particular student or the cohort of students. So competency comes out very strong. Yes, we need to ensure that they are competent to do their work, what they're supposed to do, right? So this is great. So if that is the case, how can we make sure our programs can actually deliver what we want to see at the end of the training program? So this brings us back to the discussion of quality. What is quality? So with that, I'm going to stop here and I'm going to invite my good friend Gominda to define quality. What is quality? Okay. All right. Over to you, Gominda.
Thank you, Dujeep. Thank you for taking the easy stuff and giving me the difficult one of defining.
Sure.
So we are talking about quality, and you may have heard this term number of times in many different for many different situations, and it's good to reflect on what quality is. So quality can be defined in very many ways. There are different dimensions to quality. So basically, this is a dictionary type of definition that I'm going to first give you, which is the basic English meaning of quality and the word assurance. So the basic English meaning of the language wise meaning of quality is supposed to be, it's a degree of excellence. To which degree have we made the mark, right? So if that is quality, then assurance is, it's said a positive assertion. That is, we are asserting, we are saying that quality, there is quality in our product, right? So quality assurance is all about assuring or making excellence happen. Now, quality assurance, so quality assurance can be termed as a positive assertion of the degree of excellence. Now, this degree of excellence, we can measure it very many ways. Very many ways. So what are the aspects that you think that we can look at when we are thinking about quality assurance or quality? What are the aspects? I leave it to you to think about it, and I will come back to it in a little while. But more importantly, just now you typed in some words like competent, compassion, empowering, and so on, humane, and so on. That's about thinking about the graduate that you produce, or the professional that you produce. But can we know, can we think a little bit on how will quality assurance assist this central purpose of developing such a graduate? How will quality assurance assure that? Or how will quality assurance make it happen? In other words, why quality assurance? I mean, you can use the chat if you want. So there again, that depends on which angle that you look at. Okay, safe practitioner. So there are different ways that which we can look at quality. One is safety of practitioner, safe healthcare, to ensure the expected standard. I think meet client expectations. So, I mean, all these are true, correct. So if you look at this sort of diagram, you will see that quality assurance can be used to achieve many things. One, as you said, is safety. Stable and a competitive product, because after all we are producing some product, that is our healthcare professional that we produce. And is that person competitive and stable? Stable means that that person is capable of doing what he or she is expected to do. But competitive means that he or she is comparable with the rest, with that same category rest of the world, so that our healthcare delivery is on par with rest of the world. And quality assurance may save money and time, because if we know what is not doing well, if we fix that early, then a lot of trouble can be avoided, right? And as you said, meets clients' demands, keeping the client happy and satisfied. That is very important, because after all, we are providing this, whatever the service, to people, and those people should be satisfied with our service. Reputation. Now, as you know, Sri Lanka has sort of a good reputation in terms of, in this part of the region, in terms of some other health indices like life expectancy, maternal mortality, infant mortality, and so on. So that's what reputation can do. And reputation sometimes can have a positive effect, because now our healthcare professionals may be more geared to protect it, because we have earned a name. Now we don't want to lose it. So that may have a sort of an add-on additive effect on quality. And also quality assurance will ensure it. Then probably this is another sort of an additive effect. So when we know that we are assuring quality, it gives us a new face, new look to the project, and a new determination. Okay, we should do even better. So for all these reasons, quality assurance, as Bujipa showed, is now an integral part, not something outside, but an integral part of any training program. Now, getting back to what I said earlier, looking at quality in different angles. So there are different ways that we can look at quality. One is, these are all, I mean, mostly these are borrowed from industry, other industries. These are not the only three. There are many others. So one is zero defects. One may be meeting a pre-agreed standard. Another may be judging fit for purpose. Now, what I want you to do is, think of these three in terms of a training program, an educational program. Out of these three, what do you think may be best fitting for an educational program? Okay, I am going to launch a poll and you can answer. You can select one of these that you think is the best for an educational program to determine quality of. Okay. I see now 16 have answered. That is 27. So keep them coming in. You have to only select one and click it. keep them coming fast so that I can close the poll early. Now it's just more than half have answered, that is 55%. Okay, I'm going to close the poll in a few minutes, maybe a minute or two. Okay, so we have a mix of answers. Probably the least preferred is zero defect, and there is a reasonable balance between meets a pre-agreed standard or fit for purpose. Okay, let me end the poll. Yeah, 58% now. Okay, let me end the poll. Yeah, that's the poll, what you can see just now. Okay, I'm going to stop sharing the poll. So it's a close contest between meets pre-agreed standards or fit for purpose. So basically there is nothing right or nothing wrong. You can look at quality in all these ways. For an educational program, I agree, zero defects may be not, it's a more type of a physical product related quality term, zero defects. And our products are humans, so you cannot produce humans with zero defects or professionals with zero defects. And these defects are also cannot be categorized or cannot be defined in a way that a product, in a way that we can find a defect in a product. So probably you are right in saying zero defect may not be a preferred way of defining quality in a healthcare delivery or in healthcare training situation. But out of the two of these two, fit for purpose and meets pre-agreed standards, I think both are suitable. But number two is probably more prevalent in healthcare education settings and even in other education settings, probably because fit for purpose may be okay, but if you look at one quality aspect and then say this is fit for purpose, then you have to say this is fit for purpose for this, because the same aspect will be used to define another activity also. For example, now let's say one of the quality standards would be having a sort of a student handbook. Now the student handbook can be used to convey what the teaching learning methods are. Student handbook also can be able to will be able to convey what is the assessment methods are. Now, is the student handbook fit for purpose? It may be fit for purpose for, or we can decide by looking at the program and the student handbook, it is fit for purpose for teaching learning, communicating teaching learning. But there may be some places, some things to improve with regard to assessment. So the same student handbook is not fit for purpose for assessment. So because the same thing can be used in many different ways, sometimes looking at fit for purpose can run into trouble because we are looking at different things. So therefore, far better to have an agreed standard. Okay, for teaching learning, this is what the student handbook should say. For assessment, this is what the student handbook should say. For learning facilities, this is what the student handbook should say. So that's sort of a standard, agreed standard. That standard may be very contextual. We can't apply standards from other parts of the world. අපිට මේ වෙන රටවල තියෙන ඒවා මෙහෙට එහෙමම apply කරන්න බැරි වෙයි. That's okay, as long as we have agreed this will be our standard, and the standards can change. Standards වෙනස් වෙන්න පුළුවන් as we go along, because expectations change, facilities change, technologies change. So having a standard in mind is good. මොකද එතකොට ඒක අපි දන්නවනේ. Then all of us know what do you mean by a standard. We have defined the standard. එතකොට then all of us are on the same page. එතකොට we can implement. නැත්තම් අපිට මොනවාක්වත් එහෙම quality assurance system එකක් ක්‍රියාත්මක කරන්න බැරි වෙනවා. So most of the time in education we will go to number 2, but number 3 is a very good way of also defining quality if we exactly know what we need. But here we will exactly know what we need. මෙතෙන්දී ආයිත් කතා දෙකක් නැහැ මොකද අපි define කරලානේ. Right. So these are the quality dimensions. So what are the aspects that you can look at through quality? So here are some: education, research, service, or any other. We call these criteria in quality assurance vocabulary. We call this criteria. So all these criteria will have different standards. A standards අනුව තමයි අපි බලන්නේ මේ criteria එක අපි කොච්චර හොඳට කරලා තියෙනවද නැද්ද. So that is the overall definition of quality. Now I will pass on to the Jeep again to move on with an interesting activity. Over to you, Dujip. I don't know.
Okay.
Let me.
Thank you, Gominda.
Stop share.
So, okay, thank you. Yeah, so Gominda is doing the hard work and I'm doing the easy parts now. So basically, දැන් අපි quality define Gominda quality define කළා. තත්ත්ව පාලනය සහ ගුණාත්මක භාවය අධ්‍යාපන ගැන කතා කරනකොට දැන් these are the areas that he actually discussed quality, and the quality, the discussion on quality, all these angles are really true, and this has been defined by many different people, how the quality is defined. වැදගත් වෙන්නේ අපි සියලු දෙනාම එක්කහුව වෙලා මේ agree වෙන්න ඕනි අපේ මේ program එකට නැත්නම් අපේ මේ profession එකට මේවා තමයි quality indicators කියලා, and එකම important way ඒක benchmark කරන්න ඕනි international standards වලට. ඒ කියන්නේ international standards කෙලින්ම අරගෙන use කරනවා නෙමෙයි, but we have to benchmark it. We have to say that මේවා internationally මේ standards සහ තත්ත්ව පාලනයට සමානයි කියලා. මේ අංග. අපි ඒකට දැන් එමු. හැබැයි ඊට ඉස්සෙල්ලා මම පොඩ්ඩක් ඉක්මනට මේ ගුණාත්මක භාවය හා තත්ත්ව පාලනය, especially in health professions education and in healthcare, I want to give you a little bit of background history. මොකද it is important to see that actually this is not a Western concept. මේක මේ අපි සුද්දාගෙන් එන එකක් නෙමෙයි. මේක ඇත්තටම Eastern philosophy, and especially in Eastern medicine, Ayurveda, in traditional Chinese medicine, this is actually imbibed or inculcated in those truths or the traditions. What happened was that I was involved in this standards and quality assurance in medical education, and now in ASEAN accreditation, setting up of ASEAN accreditation standards. So one of the things that I did was that to go and look little bit of researching around this. What's the history? කොහොමද මේක විශේෂයෙන්ම ආසියාවට මේ ආසියා පැසිෆික් කලාප වලට ආවේනික වෙන්නේ. මේක පිටරටින් එන දෙයක්ද? මේක ආගන්තුක දෙයක්ද? ඇත්තටම හොයාගෙන යනකොට there's quite a lot written about quality assurance in medicine and medical education in our own traditional systems. For example, in Charka and Shushruta, the Ayurvedic text from 6th century BC, these are very clearly written down, right? මොනවද මේ Ayurvedic practitioner කෙනෙක්ව train කරන හැටි. එයාව තත්ත්ව පාලනයකට ගේන හැටි. එයාගේ practice එකේ ගුණාත්මක භාවය මේ තියාගන්න හැටි. And if you really go into the other areas, like for example, there's very good information about how different Chinese dynasties, they focused on specifically ensuring quality in training in traditional Chinese medicine. මම මේක ගැන වැඩිපුර විස්තර කරනවා මගේ lecture එකේ keynote address එකේ අපේ conference එකේ. So if you are coming to that, you can get a little bit more understanding. But what I want to highlight here is that this is not something alien to us. It is not a completely a Western concept. However, how quality assurance in medical education and health professions education started off is basically in a more systematic way, in allopathic medicine, is with the start of the Industrial Revolution. So during Industrial Revolution, what happened? The classic example, it's our car, right? So the very first car, පළවෙනිම motor රථය හැදුවේ Daimler-Benz. Daimler-Benz motor රථය හැදුවේ තනිකර what we call a master craftsman. ඒ Daimler-Benz යාගේ team එක එකතු වෙලා ඒගොල්ලොම රෝද හැදුවා. ඒගොල්ලොම engine හැදුවා. ඒගොල්ලොම එක එක parts හැදුවා. So when they put things together as a master craftsman, they developed this Daimler-Benz, the perfect automobile. But people wanted more and more automobiles. So therefore, it takes a long time to develop by the master craftsman. So therefore, you had to go into this assembly line things, where in one assembly line they will make the tires, another the steering wheel, another the electrical components, another the engine parts, and then they will put everything together. So that is the very first industrial motor car. That is the Ford Silver Ghost on your right side, you can see, right? But when that happens, not one person is making the car. තනි පුද්ගලයෙක් team එකක් නෙමෙයි තනිකර කාර් එකක් හදන්නේ. එක එක කට්ටිය එක එක තැන්වල හදලා ඒ කාර් එකේ කැලි ටික assemble කරලා ගේනවා එළියට. එතකොට තත්ත්ව පාලනය වෙනමම අංශයක් තියෙනවා. මේකේ තත්ත්ව පාලනයක් තියෙනවා. මේකේ light වැඩ කරනවද, brake වැඩ කරනවද? ඒකට වෙනමම අංශයක් තියෙනවා. ඒගොල්ලෝ තමයි මේක check කරන්නේ. So this is where the quality assurance actually started off in modern history. So how does it focuses on the quality assurance and quality improvement movement in healthcare? Actually, අපේ nursing officers would be so proud, because it's actually the history shows that it started with Florence Nightingale, because during the Crimean War, that she observed observation of the germ theory, which that if you wash your hands, actually the number of people who would get infected and die drastically reduced. So that's where it said that, you know, the first quality assurance movement started off, according to this book by Cassie and Owen that I showed you earlier, that it started with O'Kane, Cassie and O'Kane, that it started off at the Crimean War. And then in medical education, it is the initial thing in allopathic medical education, Western medical education, with Abraham Flexner's report in 1910. So me story ka mama me කිව්වේ මොකද මේ concept of quality assurance, තත්ත්ව පාලනය සහ ගුණාත්මක භාවය ඇත්තටම පටන් අරගත්තේ more Eastern philosophies වලින්. So it was there, it was built into these systems. And then, of course, the Western allopathic medicine took root, and then it developed from there onwards. Right, now we are going to stop talking about all this, and we are going to talk about how to make tea. Right, මෙතන කවුරුවත් ඉන්නවද තේ හදන්න දන්නේ නැති කට්ටිය? Right, හැමෝටම පුළුවන් තේ හදන්න නේ. හරි, එහෙනම් මම දැන් මොකද මම අතාරිනවා මගේ platform එකේ, ඒකට 8 දිනක් විතරයි එන්නේ. ඉතින් ඒක නිසා මම chat box එක පාවිච්චි කරනවා, and also මම පෙලක් කට්ටිය අහනවා. දැන් මට පේනවා මෙතන ඉන්නවා මගේ හොඳ යාළුවා ඩොක්ටර් උමංග සූර්යාරච්චි. දැන් මම උමංගගෙන් ප්‍රශ්න පිට ප්‍රශ්න අහනවා මේකට. right, උමංග තේ හදන්න දන්නවද?
දන්නවා.
හොඳයි. උමංග තේ හදනවා නම් හොඳයි. දැන් එතකොට දැන් මම ඉස්සෙල්ලාම අහන්නේ අපි කොහොමද තේ කෝප්පයක් හදාගන්නේ? right, කොහොමද අපි තේ හදන්නේ? මොකක්ද අපි තේ හදන්න පාවිච්චි කරන්නේ. දැන් උමංග පටන් ගන්නකො කොහොමද උමංග ගෙදරට යාළුවෝ කට්ටියක් ආවම මේ අමුත්තන්ට සංග්‍රහ කරන්නේ කොහොමද ඔයා තේ හදන්නේ?
එළම තේ හදන්න ඕනි ටික හොයා ගන්න ඕනේ.
ඕකේ.
කියන්නේ මේ items ටික ලෑස්ති කරගන්න එපා ඉතින්. ඒක තියනවාද කියලා බලලා ඒ ටික එකතු කරගන්න.
හරි. ඊට පස්සේ හරි items ටික හොයාගන්න. දැන් අනික් කට්ටිය please put your thoughts into the chat. What would you do? How would you make tea? How do you actually make tea to serve your friends? Right?
either chat or unmute කරලා කතා කරන්න.
Unmute කරලා කතා කරන්නත් පුළුවන්. ඔව් unmute කර. මොකද this webinar and we are running both myself and Gominda, we are medical educators. Medical educators ලා engage කරගන්න නැතුව නිකන් didactic lecture එකක් කරනවා නම් it is not proper. So we want to get you engaged, right? හරි right උමංග. දැන් ඔයා කිව්වා මේ ඉස්සෙල්ලම බඩු ටික එක්කව කරගන්න කියලා. හරි. ඊට පස්සේ මොකද?
කී දෙනෙකුට දැන් හදන්න කියලා දැනන් ඉන්න එපා. ඒ ටිකට හරියන්නත් එපා තියෙන ඒවා ටික.
හරි. Okay, very good. Okay, assemble the equipments. හරි. අර කට්ටිය කියනවා. ඊට පස්සේ හරි. ඊට පස්සේ ගාන හොයා ගන්නවා. ඊට පස්සේ කේතලි හොයා ගන්නවා. දැන් ඉතින් ලොකුම ප්‍රශ්නේ මට ආරංචි වුණා ලංකාවේ මේ සීනි පිටි හොයාගන්න. හරි කවි. හිතාගමු එක තිබුණා.
ඒක නිසා අපි ප්ලේන් ටී හදනවා.
either plain tea හදනවා. Right. Okay. So now that is an important thing. Right? Okay. දැන් ඔයා දැන් තීරුම් ගන්නවා දැන් මම මොකද්ද දැන් කරන්නේ මම හදන්නේ plain tea ද මම හදන්නේ කිරි තේද මම හදන්නේ ඉඟුරු තේද දැන් ඒක depend වෙනවා ඔයාගේ ingredients වල මත සහ
ආපු අයගේ අවශ්‍යතාවය. ආපු අයගේ අවශ්‍යතාවය.
excellent, very good, very good. ඊට පස්සේ
ඒක හදන්න ඕනි ස්ටෙප්ස් ටිකක් තියෙනවානේ. ඒ ටික පටන් ගන්නවා. කියන්නේ වතුර උන් කරන්න ඕනේ.
හරි.
හොදලා ඒක ලෑස්ති කරලා තියන්න ඕනේ.
හරි brilliant. ඒ steps ටික ඒ විදිහට කරගෙන යන්න. right? හරි. ඊට පස්සේ
අපි බලනවා තේක හදලා ඒ විදිහට සර්ව් කරනවා විදිහට තියලා ඊට පස්සේ අපි අදාළ පාර්ශවයට තේ දෙනවා. ඒක self serving හරි ඒ විදිහට ඒ අයගොල්ලන් තියෙන විදිහට හරි අපිට තියෙන විදිහ බලලා ඒ arrangement එකට අපි serve කරනවා.
Excellent, very good. So I can also see some comments on the chat. First, find out how much tea is necessary. Ask what they want. Then the process, etc. Very good. ඊළඟ පාර ලංකාවට ආවම මේ උමංග මම එනවා තේ එකක් බොන්න. Right? So very good. Okay. All right. So now let's dissect. Let me summarize what Umanga and the others shared in the chat. Right. So okay, I'm not going to go into this. Yeah. First, ඉස්සෙල්ලම අපි බලන්න ඕනේ මොන විදිහේ තේ එකක්ද අපි හදන්නේ. Right? මොකද මොන වගේ තේ එකක්ද? මේක කහට තේ එකක්ද, කිරි තේ එකක්ද, ඉඟුරු තේ එකක්ද? ඒක මේ අයිස් තේද ඕනි? නැත්නම් මේ hot tea ද ඉස්සෙල්ලම අපි දැනගන්න ඕනේ අපි තීරණයක් ගන්න ඕනේ මොන වගේ තේ එකක්ද අපි හදන්නේ. Right? ඒක තමයි most important. ඒක දැනගත්තාන් පස්සේ අපි ඊළඟට අවශ්‍ය කරන ingredients ටික හොයාගන්න. Right? තේ ටිකද, සීනි, පිටි නම් පිටිද නැත්නම් liquid milk ද, right? මේ මොන වගේ වතුරද පාවිච්චි කරන්නේ සාමාන්‍ය ඔකේ ටැප් එකෙන් ගන්න වතුර සමහර කට්ටිය කියනවා මම ලිඳෙන් හදන වතුර මේ ලිඳෙන් එන වතුර ඊට වැඩිය රහයි ඒක නිසා ටැප් එක නැතුව ලිඳෙන් ගන්නවා කියලා ලිඳක් තියෙනවනම් ඒ වගේ මොන වගේ වතුරද පාවිච්චි කරන්නේ ඊට පස්සේ අර කිව්වා වගේ the process of making the tea, right? තේ ටික හදා ගන්න විදිය. හරි හරියට වතුර තම්බලා වතුර උණු කරලා හරි විදියට මේ තේ පෝච්චියට මේවා දාලා ඒ විදිය ඒ විනාඩි 2-3ක් ඒක තැම්බෙන්න ඇරලා ඒ විදියට පාවිච්චි කරනවා. ඊට පස්සේ අපි පොඩ්ඩක් තේ ටේස්ට් උත් කරනවා නේ. උමංග පොඩ්ඩක් අතට දාලා බලනවානේ තේ හොඳද නැද්ද කියලා. right? තේවල තත්ත්වයක් පොඩ්ඩක් ටෙස්ට් කරලා බලනවා ඉස්සෙල්ලම දෙන්න ඉස්සෙල්ලා මේකේ සීනි වැඩිද මේකට තව ටිකක් සීනි මදිද මේකට තව ටිකක් කිරි ටිකක් දාන්න ඕනේද කියලා තේවල තත්ත්වයක් ටිකක් තක්සේරු කරනවා. ඊට පස්සේ තමයි අපි තේ ටික පිළිගන්නේ. right? දැන් මේක process එකක්. right? අපි දැන් මේ process එක ඒ විදිහටම බලමු කොහොමද අපි එක එක අංශවලට කඩාගන්නේ කියලා. මේ same, this is the same process when we engage in developing or evaluating a module. So what do we do, right? So finally the satisfaction of the customer. First එක තමයි අපිට very clear outcomes තියෙන්න. We need to know from our program what are the end product capabilities, right? ඒක ඉස්සෙල්ලම දැනගෙන තියෙන්න ඕනේ. මොන වගේ outcomes ද? Knowledge outcomes, psychomotor outcomes, ඒ කියන්නේ skills outcomes and affective outcomes. එහෙම නැත්නම් අර මේ තියෙන අර empathy, professionalism, communication skills, ඒ වගේ affective domain එකට බලපාන outcomes, right? So මොනවද මගේ program එක ඉවර වෙලා මගේ මේ trainees ලට පුළුවන් දැනුම සහ skills සහ ඒගොල්ලොන්ගේ අද මේ affective domain එකේ තියෙන outcomes ටික මොනවද? ඒ ටික very, you must be very clear. So you have to have that. And once you have that, you then check with international benchmark standards. දැන් මේ වගේ nursing program එකක් අවුරුදු 3ක් අවුරුදු 4ක nursing program එකක් හරි physiotherapy හරි pharmacy program හරි medicine program එකක මේවා internationally මේවා මේ හා සමානද, right? මේ benchmark සමානද? මොනවද මගේ context එකට මගේ රටේ මගේ මේ practitioners ලට අවශ්‍ය කරන ඒවා ඒවත් මේකට ඇතුළත්. ඊට පස්සේ ඊළඟ එක තමයි මොනවද අවශ්‍ය කරන resources or inputs we call it, right? So මේක මේ outcomes achieve කරන්න මොන වගේ content තියෙන්න ඕන? මොන වගේ how many activities, lectures, small groups, practicals, practicums, etc., ward classes, etc., right? ඒවා තියෙන්න ඕන. මොන තරම් ප්‍රමාණයක් lecturers ලා ඉන්න ඕන? ඒගොල්ලොන්ගේ මොන වගේ සුදුසුකම් සහ මේවා තියෙන්න ඕන? ඒවා ටික, right? ඊට පස්සේ මම කොහොමද මේවා ටික nicely string කරන්නේ? How do I actually bring these things together in a very organized way? මොකද්ද ඉස්සෙල්ලා කරන්නේ? ඊට පස්සේ කරන්න ඕනේ මොකක්ද? ඊට පස්සේ ඇති වෙන්න යුත්තේ මොකක්ද? කොහොමද මම මේ ටික ලස්සනට එකතු කරන්නේ? So that is the process of organizing, right? So these are the processes or activities. And then what type of outputs and outcomes? Now output or outcome ද තේවල තත්ත්වය තක්සේරු කරන්න. මේ කොච්චර දෙනෙක් මගේ මේ පළවෙනි exam එකෙන් pass වෙන්න ඕනද මේ ටික ගියොත්? මගේ දෙවෙනි exam එකෙන් කී දෙනෙක් pass වෙන්න ඕනද? කොයි තරම් lectures ටිකක් cover කරලා තියෙන්න ඕනද? එහෙම නැත්නම් කොයි තරම් මේ practicals ටිකක් cover කරලා තියෙන්න ඕනද? මේ exam එකෙන් pass වෙන්න. 80ක් pass වෙන්න ඕනද? ඒ වගේ යම්කිසි mark එකක් තියෙන්න ඕනි මොනවද outcomes. And then of course finally what is the impact? දැන් හරි මේ කට්ටිය graduate වුණා, graduate වෙලා මේගොල්ලෝ මේවා ටික කරන්න. So basically this is basically you are looking at what we call quality control, tattva palanaya at the basic program level. So there are 3 levels to quality assurance system or quality system. The first one is what I now described as quality control, right? So this is where at a program level, you can a program එක level එකේ diploma in nursing or bachelor of nursing or MBBS, එහෙම නැත්නම් MD, එහෙම නැත්නම් masters in nursing or pharmacy, A level එකේ මොනවද මම මේ තියන්න ඕනේ or බලන්න ඕනේ ඒවා. මේකට in other words this is what we call the outcome logic model of ensuring quality control, right? So you look at the resources, the inputs, the activities that you need to put in, what are the outputs, what are the outcomes, and then what are the impacts that from that program. මේක තියෙන්නේ අර මම ඉස්සෙල්ලා කිව්වා වගේ the quality control level at the program level, right? We will talk about the quality management and quality assurance a little later, but now Gominda will take us through an actual framework that was developed by the help from the Ministry of Health for a particular program. Okay, over to you, Gominda,
Okay.
to do the hard work.
Sujipa, you can unshare. All right. Okay. Great. Thanks. Yeah, back to hard work. Okay. So this is, I am sure many of you must be familiar with it because at least some of you saw this. මොකද මේ මමත් සම්බන්ධ වෙච්ච ඔය වෙබිනා වල මේක අපි ඩිස්කස් කරා. This is not anywhere else. This is Sri Lanka, your own Ministry of Health. I think ETNR, spearheaded by Dr. Umanga, did this with the help of certain other people and with the funding from WHO. So what was done was, the ministry has a lot of training programs, basic training programs. In a basic training programs වල ගුණාත්මක භාවය රකින්න කොහොමද, ඒකට තිබිය යුතු අර standards, common standard මොනවද කියලා හොයාගත්තා. එතකොට ඒක හොයාගන්න ඉස්සෙල්ලා standards වලට බහින්න ඉස්සෙල්ලා අපි දැනගන්න ඕනේ මොනවද aspects. අපි ඒකට criteria කියන්නේ. What are the criteria that we need to look at? Because the education program can be measured in many ways. Maybe by way of looking at how good the facilities are, how good the teachers are, how good the students are, how good the graduates are. විවිධ තලවරින් මේක මනින්න පුළුවන්. එතකොට අපි බලන්න ඕනේ all those dimensions, all those aspects, all those criteria are useful. So then we have to measure, best is to measure all those. එහෙම ඔක්කොම මැන්නොත් අපි දන්නවා okay මේ criteria එක තමයි මගේ weakness, මගේ training program. Then we can divert our attention, resources, all that to improve that weak point. ඉතින් ඒවා එහෙම බැලුවාම මේවා තමයි criteria මේ document එකකින් identify කරගන්න. Student recruitment and retention, teaching staff, curriculum, learning environment, student assessment, innovative educational practice. Right? එතකොට මේ criteria 6ක් තියෙනවා. මේ criteria 6 තව කැලි වලට කඩලා තියෙනවා. ඒවා තමයි standards. Then student recruitment and retention. So what is the benchmark? What is the standard? So there you will get a lot of standards. Maybe 20, 30 standards. So altogether මට මතක හැටියට 80ක්ද 80 ගානක්ද තියෙන standards. So student recruitment and retention, there may be about 20, 40, 30 standards. Each of them will focus on one aspect of student recruitment and retention. Maybe the admission criteria, maybe how the students are inducted. Is there an induction program? Is there a overall curriculum which that curriculum is being introduced to the students at recruitment? Then what if is there student counseling, so that if a student thinks that he should leave, he or she can first go to the counselor and discuss with it. Student support, ඔය ආදි වශයෙන් ගොඩාක් දේවල් එක එක ස්ටෑන්ඩඩ්ස් තියෙනවා. ඒ හැම ස්ටෑන්ඩඩ් එකේම අපි ලංකාවේ මට්ටමින් දැන් තියෙන මට්ටමේ ඉඳලා ස්ටෑන්ඩඩ් එකක් තියෙනවා. ඒ ස්ටෑන්ඩඩ් එක may not be the highest standard. Of course, anybody can reach that highest standard, but we have set a standard which is acceptable to the Sri Lankan situation. Of course, if you have achieved more, that does not mean that you cannot achieve more. ඊට වැඩි උඩින් achieve කරන්න පුළුවන්. එතකොට අපි වැඩිපුර reward එකක් දෙනවා. එතකොට මේකේ marking scheme එකක් තියෙනවා. ඒ marking scheme එකේ අර international level එකටම යන්න පුළුවන් කෙනෙක් ඉන්නවනම් they will get more rewards. So this is how it happens. So this is an example. Make our student retention well first criterion එකේ standard එකක්. This is the 16th standard, 1.16. So training institute makes available an issue of student handbook and student prospectus on the training program approved by the regulatory body or which is the Ministry of Health. එතකොට දැන් මේකට මේ ස්ටෑන්ඩඩ් එක ඕගොල්ලෝ achieve කරා නම් දෙන්නේ මොකක්ද? දෙන්න පුළුවන් දේවල් මෙතන තියෙනවා. But those are examples. Example evidence. Of course, you can create, maybe even you can create better evidence. So obvious evidence would be a copy of the handbook or the prospectus. Then evidence for handing over and communication of content of the student handbook to the students at the beginning of the program. මොකද මේ handbook එක හදලා කබඩ් එකක දාලා වහලා තිබ්බට මේ කියන වැඩේ වෙන්නේ නැහැනේ. So you have to give it to the student. How you give it? Do you upload it on the web, on your website? Or do you give a student a copy of the handbook? And do you refer to that handbook as you go along in the program? ඒ වගේ ඊට පස්සේ දැන් ඒවා අප්ඩේට් කරනවා the students ලගේ feedback අරගෙන evidence for old and updated versions of handbook. So if you have all these and at a level which is accepted worldwide, probably you will get a 3. If you don't have even a handbook, you will get 0 for this aspect. So similarly, there will be a lot of aspects. All those will be scored depending where you are. So the bare minimum that you can expect would be something like 1. Student handbook is offered at the beginning of the training program. So මේ වගේ 80 ගානක් තියෙනවා. So all those can be used to see where my weak points are, where my strengths are. Strengths I will have to maintain. My weaknesses I will have to improve. So එහෙම මේක දිහා එහෙම බලනකොට then we can see actually there are 2 processes. The main process is what I discussed just now. I within the program looking inward and seeing where my strengths and where my weaknesses are. That is the most important part of a quality assurance process. And that part of the process we call internal quality assurance. ඒක තමයි strongest. Then of course we know, because we may be biased, we may not be too good at looking at self-evaluating. So for all these reasons, although we have identified our weaknesses and our strengths, we want to see whether we have missed anything. And for that purpose, there is another arm of quality assurance, which is external quality assurance, where somebody from outside our program will come and look at our evidence and show us certain things that we may not have seen. Or if we have seen everything, our strengths and weaknesses, they will agree with what we have done. So that is an external assurance that you have your qualities at this level. So those are the 2 aspects of quality assurance: external quality assurance and internal quality assurance. Both should complement each other. However, the mainstay should be internal. It is usually that the internal quality assurance that ensures that the recommendations of EQA, that is external quality assurance, are acted upon. So may external process එකට පස්සේ report එකක් දෙනවා. ඒ report එකේ recommendation. So a recommendations, if you want to implement them, then it is up to the internal process. So the internal quality assurance process is the mainstay. External is just an additional check, which is useful because then only that we can be sure that we have achieved what we should. So that is main backbone is the internal quality assurance. So much so in advanced quality assurance systems, this alone works. But external quality assurance will never be sufficient without an internal quality assurance system. And external quality assurance system cannot operate without an internal quality assurance system. So in the document that I showed you just now, there is an extensive process for internal and external quality assurance. So all this part, the top part, the pink part is all the steps of the external quality assurance process. The orange part, sorry, the orange part is all the steps of the external quality assurance process. The pink part is all the steps of the internal quality assurance process. Right? So as you see, if you start from 1 here, that is a preparation of a self-evaluation report. That is, you go on your own internally, standard by standard, each of those criteria, and see what you have achieved. And that is your self-evaluation report. And then you submit it to the external quality assurance panel, and then they will go through it, and they will visit the institute and see whether what you have said is what is there. And then they will submit their report. And that is the external quality assurance report, which you will have to take up again and then see what they have recommended and then improve on it. So to be very brief, internal quality assurance and external quality assurance are two essential parts of a quality assurance system, out of which internal quality assurance system should be the mainstay. ඒක තමයි main මේක internal quality. මොකද අපිනේ අපේ වැරදි අපි හොඳවල් දන්නේ. කවුරු හරි පිටින් ආවහම අපිට ඕන දෙයක් පෙන්වන්න පුළුවන්. සමහර වෙලාවට ඒගොල්ලන්ට ඔක්කොම information දෙන්න නැත්නම් ඒගොල්ලන්ට ජජ් කරගන්නත් බැරි වෙන්නත් පුළුවන්. නමුත් මේක කරන්නේ මේ පිට කවුරුවත් සතුටු කරන්න නෙවෙයි. This is for our own good. ඉතින් එතකොට අපි බලන්න ඕනේ කොහොමද අපි improve වෙන්න පුළුවන්. එතකොට තමයි අර අපේ reputation එකට හොඳ අපේ graduate හොඳට deliver කළා අපේ මේ රටේ health care status එක ඉහළ නංවල තියන්න පුළුවන් වෙන්නේ එතකොට. So those are the main 2 points that I wanted to talk about the external and internal system. And what is happening at the moment, and this will be a main part of your educational program in the future. Okay, Dujipa, over to you. Dujipa, you are muted.
All right. Okay. Thanks, Gominda. So Gominda took us through the entire process of quality assurance. So let me try to kind of summarize what he shared and some of the challenges and evidence behind all this. Now, what he discussed earlier is what okay. Okay. එතකොට පටන් ගන්න ඉස්සෙල්ලම quality framework එකක් program level එකේ implement කරලා. ඒකට තමයි අපි කියන්නේ quality control කියන්නේ. So the quality control happens at a program level. But now let's look at the next level, what we call the quality management. Now the quality management happens at a school level. දැන් මොකද එක මේ institution එකක multiple programs තියෙන්න පුළුවන්. So diploma nursing තියෙන්න පුළුවන්, bachelor's තියෙන්න පුළුවන්, postgraduate diplomas තියෙන්න පුළුවන්, midwifery programs තියෙන්න පුළුවන් nursing school එක ඇතුලේ, right? So ඒක නිසා multiple programs තියෙන්න පුළුවන්. So මෙහෙම multiple programs තියෙනකොට දෙවනි level එක බලන්නේ අර internal report එක ඊට පස්සේ අර external visit එකක් ගැන කතා කළේ ගෝමින්ද external visit එකේ බලනවා මේ quality management එක කොහොමද at a school level. So quality management එකේ මොනවද බලන ඒවා. Basically quality management එකේ බලන්නේ whether there is an oversight, right? මේ school එකේ අපි ගත්තොත් nursing මේ school එකක් whether the principals got the oversight. Or medical school එකක් ගත්තොත් එහෙම medical school එකේ whether the dean has an oversight of all these other programs and activities. Whether the school is providing the necessary resources and there are proper management processes to create that safe, conducive learning environment for students, for teachers and other stakeholders like patients and others, right? So that visiting team එක බලන්නේ අර program එකත් බලනවා, ඒ program එකත් එක්ක බලනවා, ඒ program එකට හොඳට develop වෙන්න, ඒ program එකට හොඳට වැඩ කරන්න පුළුවන් වාතාවරණයක් ඒ ආයතනය මගින් ලබා දීලා තියෙනවා, right? එහෙම නැත්නම් ආපහු මොකද that's a sure way of that program is going to fail, even though the program has put in all kinds of high quality standards, right? So quality management වල බලනවා මේක එක level එකක් උඩින්. දැන් කොහොමද ඒක A level එකකින් වෙන්නේ? ඉතින් එතකොට there are different ways of focusing on these quality management systems in education. So first of all, you look at what is the institution's conception of quality and methodology of doing quality. How do they manage this? Is there a plan? What is the strategy? School level strategy, right? Principal completely මොකක්වත් මේක ගැන දන්නේ නැත්නම් මාර ප්‍රශ්නයක්. ඒක පොඩ්ඩක් තියෙන්න පුළුවන්. මොකද අපේ මේ ලංකාවේ මොකද අපේ මේ දේශපාලකයන්ට මතක නැති වෙනවනේ. මොකද කොහොමද ගෙවල් හැදිලා ආවේ, කොහොමද මේ සල්ලි account පැන්ඩෝරා වලට වැටුනේ කියලා. ඉතින් ඒක නිසා අමතක වෙන්න බෑ. මේ standard වැඩ කරනකොට, right? So principal or the dean can't forget, right? මේ කොහොමද මේ strategy එක ගැන අමතක වෙන්න බෑ. So that whether the main stakeholders, whether they do have a plan or a strategy. And then of course the system. How does the institution actually operationalize this system and build the culture? And mami culture එක ගැන පොඩ්ඩක් කියනවා later on. How do we build the culture, quality culture within the organization? So external team එක බලන්නේ ඒවත් ටික. අර program එකේත් බලනවා ඒකේ හරියට lectures හරියට තියනවාද, content හරියට හදලා තියනවාද, අර අපේ quality control ඒවා ටික ඉස්සෙල්ලා, ඒකේ හරියට assessment තියනවාද, ඒකට හරියට lecturers-ලා ඉන්නවද, ඒකට හරියට library තියනවාද, but ඒකත් එක්කම බලනවා at a institutional level කොහොමද institutional level එකේ මේකට හරියට මේ resources ඒවා මේවා දෙන්නේ. So එතකොට මේක basically හතරක් වෙනවා. එකක් තමයි enablers. Enablers කියන්නේ whether the standards and framework තියනවාද හැම program එකකට. ඒ මේ nursing school එක හරි, pharmacy school එක හරි, medical faculty එකේ හරි ඒ programs වලට එක programs වලට standard framework එකක් තියෙනවා. මොකද්ද standard operating processes? අපි SOPs කියනවා, implementation. ඒක next එක. What are the SOPs? Standard operating procedures, right? So do we have established systems and processes in place? තුන්වෙනියට බලනවා, is there a streamlined way of collecting and analyzing this data, right? දැන් මේවා ඔක්කොම තිබුණත් වැඩක් නැහැ ඒ data හරියට collect කරන්න නැත්නම්, right? මේ registrar's office එකේ හරි එහෙම නැත්නම් මේ principals administrative office එකේ හරි හරියට බලන් ඉන්නවද, monitor කරනවද, ළමයි එනවද, attendance mark කරනවද, මේ lectures ටික හරියට වෙනවද, practicals ටික හරියට වෙනවද, මේ test ටික හරියට වෙනවද, කී දෙනෙක් pass වෙනවද, ඒව ටික ඔක්කොම මේ data, how do they collect that data and how do they analyze this data and how do they give this data back to the stakeholders? And then the last bit is that, is there a plan for continuous improvement and innovation? Now මේවා ටික ඔක්කොම අර internal document එකේ ගෝමින්ද කිව්ව තියෙනවා, right? ඒ එකම අර external කට්ටිය ඇවිල්ලා බලනවා මේවා ඇත්තටම වෙනවද on the ground, right? Are there standards and frameworks in place? Do they have standard operating procedures, SOPs? Do they have a mechanism to collect data and analyze data and to make value judgments? And do they have a plan to continuously improve the gaps and also build on their strengths? මේවා ටික තමයි quality management level එකෙන් බලන්නේ. So මේවා සාර්ථක වෙන්න සමහර factors ටිකක් තියෙනවා. Now these are all across the world. This happens day in and day out in many of the centers. So basically, what are the critical success factors? First of all, whether it is very student focused, right? Make a student centered process එකක්ද. is there a very strong and supportive leadership, right? Whether all the stakeholders, especially the leadership, are they supportive? අමතක වෙන්න බෑ, right? මේ කොහොමද මේවා උනේ කියලා මතක නැති වෙන්න බෑ. Are they engaging all stakeholders? මේක වැදගත් සියලුම program manage කරන කට්ටිය, key lecturers ලා, key administrators ලා, මේවා ඔක්කොම are they engaged? එහෙම නැත්නම් මේක මේ පොඩි dean ගේ යාළුවෝ ටිකක් විතරයිද කරන්නේ, right? අනික් කට්ටිය වයින් කරලා. එහෙම නැත්නම් principal ගේ හොඳ මේ ගජයෝ ටිකක් විතරයි මේකට දාගෙන ඉන්නේ. එහෙම බෑ, right? ඒකට ඒව තමයි external කට්ටිය ඇවිල්ලා බලන්නේ. මේක හැමෝම එකතු වෙලා එකමුතුව කරන එකක්, right? එහෙම නැත්නම් ඒව පෙන්නන. ඊට පස්සේ whether there is a systematic process of collecting data and making decisions based on evidence. ඒක ඉතාමත් වැදගත්. මේ improve කරන්න ගන්න decisions, are they best evidence? Are they based on good evidence, right? මේවා තමයි gaps. ඒක නිසා අපි මේවා කරන්නේ මේ හේතුන් මත. learning sciences වල කියලා තියෙනවා මේ විදියට කරොත් අපේ මේ ළමයින්ගේ මේ දැනුම වර්ධනය වෙනවා. ඒ කට්ටියට critically analyze කරන්න පුළුවන් වෙනවා. එතකොට අපි මේක lectures වලින් තනිකර පැයක් දෙකක් වෙන lecture එකෙන් මාරු වෙනවා මේ more engaged session එකකට. හැබැයි එන අනිත් පැත්තට කියනකොට අපිට engaged session කරනකොට අපේ ළමයි 400ක් ඉන්නවා. නැත්නම් 500ක් ඉන්නවා. එතකොට අපිට කරන්න පුළුවන් lectures. ඒතකොට lectures දෙනවා. හැබැයි ඊට පස්සේ අපි මේවා කරනවා ඒ ළමයින්ට ඒක ගැන තව ටිකක් වැඩිපුර අවබෝධයක් එන විදියට. Right? So those evidence based decision making process එකක් කරනවා. And that is how you engage in continuous improvement. And also most importantly, now there's a lot of focus on this in quality assurance and accreditation systems, whether we are creating a safe environment, right? ළමයින්ට සහ teachers ලට lecturers ලට whether the learning environment is safe, right? So those are important areas. So මම කියන්නේ culture ගැන මම පොඩ්ඩක් කතා කරනවා කියලා. Now I will be talking a lot more during my keynote, but these are some important areas because if the institutional culture is not geared towards quality improvement, then it is very difficult to get things done, right? So how do you do it? Leadership has a lot to play here, but also getting everybody together and then training them, skilling them, and empowering them is extremely important to ensure good quality, good culture to ensure good quality education. Right. එතකොට අන්තිම එක තමයි quality assurance. Now quality assurance වෙන්නේ at the highest level. ඒගොල්ලෝ තමයි ඇවිල්ලා බලන්නේ මේක හරියට වෙනවද, whether the processes are happening properly in the school, etc. So මේගොල්ලෝ තමයි ඔය අපි කියන්නේ මේ medical council. like මේ සිංගප්පූරුවේ අපේ තියෙනවා මේ වගේ councils 6ක්. medical council එකෙන් තමයි ඔක්කොම quality assure කරන්නේ undergraduate medical programs and also the residency programs in relation with collaborating with some other external agencies. Singapore Nursing Board ensures all the undergraduate, diploma, masters and advanced practitioners nursing training programs. Singapore Nursing Board. Singapore Pharmacy Council looks after all the Bachelor of Pharmacy, doctorate in pharmacy, DPharm, masters in pharmacy and clinical pharmacy programs, and master clinician practitioner training programs. The Allied Health Professionals Council looks after all the other health professions and to ensure standards at different universities and training centers and polytechnics. And of course, there's another one, the Traditional Chinese Medicine Practitioners Board, which also looks at the training programs, because there's no training program for traditional Chinese medicine in Singapore. So whether the practitioners actually come from registered and standard insured training programs from China, Malaysia, and Indonesia and other places. So they also keep an eye and they only register them to practice. And in Singapore, allopathic medicine and the traditional medicine work hand in hand very collaboratively in all our public hospitals. Okay, so accreditation boards and systems are at the highest level. ඒගොල්ලෝ තමයි අර external visits කරන්නේ schools වලට, and then they go and look at the programs as well. And if they are not up to a standard, they can stop that particular training program. So for example, thankfully in Singapore this has not happened, but good examples are, for example, the Wales, in Wales in United Kingdom very recently, the medical school in Wales, they were asked to stop training medical students because their standards were poor. So they had to stop, and they sent all their students to other medical schools in the UK, and they had to work hard for 3 years to improve their settings and to bring that medical school back on board, because the General Medical Council stopped the Wales school, medical school from operating. Similarly, postgraduate education, very recently, New York Medical Center, they stopped training postgraduate medical students, right? So they stopped all the residency programs and at New York, and then they said that they are going to stop because the standards are so poor. So they have the bite, right? So they can stop training at the highest level. So all these, you can see that there are many standards in place all over, right? And what is important is that the standards set by these councils, right, or nursing boards and other boards, or what we call independent bodies, right? They are independent. They work independently, and they are in almost all the countries. They are established by statute, by an act of parliament, right? So they work independently. No one, the minister can't come in, or the prime minister can't come in. They work quite independently. I don't know how that is going to happen in some other parts, but usually they are very independent bodies, right? So they are the ones who develop standards. However, remember, the standards are a guide, right? They are not curriculum, right? It's a framework which takes into account the local context, right? They are not a curriculum. They are emphasizing again and again, they are not a curriculum. They are saying that these are the standards, right? And these standards are based on the local context, benchmarked to an international standard. And then, of course, the schools and the programs, they need to share how they are close, or what are the gaps in their program with regard to these standards. So finally, these accrediting bodies will make the final decision whether to allow give full status, or grant what they call provisional approval, or to say that this school needs to be, this program needs to be stopped for these reasons. So you can see this is from the World Federation of Medical Education, which I am part of right now. So you can see that they have come out very clearly with, for basic medical education, there are 8 standards, which Gomind actually showed you, that shared with you earlier. Postgraduate for medical education, continuous professional development as well. Just very quickly, there are few challenges to this frameworks, right? Because one, still we don't have very clear alignment to say that by doing these standards, the graduates will be able to perform well. So there's no very clearly established link right now. We are looking at it, but we cannot just say that because this is standards are very good, the graduates will perform, all the graduates will perform exceptionally well. Well, of course we can't, because we are all human, right? So some will work very at a higher level, and then there will be, of course, there will be few. But the thing is that we want to push the Gaussian curve to the right. We do know if the standards are not good, there's a high chance that the majority will not do well, right? So that's what we want to prevent. But what it has shown is that by having the standards, there's a very strong impact on developing good quality teaching and learning, right? So standards have helped to improve the quality of teaching and quality of learning and assessments, and creating that safe environment for the practitioners or the trainees to learn, so that they become very good practitioners. So there's a high chance that they will be able to provide good quality care in the future, right? So these are some of the challenges, and some people use the accreditation as a guard dog, right? To bite, some as a guide dog, some just to show off, right? We are the number one, and we are at National University Singapore. We like to show like a lap dog to say that we are the number one medical school in Asia and number 10 in the world and all that, right? So we try to show off as well. So sometimes they use as a lap dog, but what is really what we want is that standards to be like a guide dog, right? To guide good quality training programs across. Right, so I think these are some areas. Now, my last thing is what is happening in the future. But before I come to that, I'll probably stop here because we have little time for few questions because all the difficult questions Gominda is going to ask. So you can ask all those difficult questions from Gominda, and the easy ones only I will answer.
Okay, let me avert one of those questions. So for that, now what you just now saw about quality control, quality management, on quality assurance. Now, when this document that I showed you for the Ministry of Health, when it was developed, I know the people there were really concerned whether we should have for the individual programs a separate quality standard guide, and for the institutes a separate quality standard guide. But the overall consensus, as far as I know, was මේ දෙකක් කරන්න තරම් facilities, human resources, මේ nursing schools වල නම් ටිකක් හරි තියෙනවා. තව allied health profession schools වල ඊටත් අඩුයි. ඒක හින්දා ඒ දෙක එක්කව කරලා ඔය තියෙන පොතේ තියෙනවා. ඊට පස්සේ අර මම පෙන්නපු අර උඩ තියෙන රෝස පාට section එක ඒක තමයි at the ETNR level where the assurance of quality happens. So අර මම මේ දුජීප කියපු එකත් එක්ක අපේ context එකට දාලා ඔය කිව්වේ එතකොට තේරුම් ගන්න ලේසි වෙයි. So it will be easier for you to understand.
So that's another adaptation, right? So sometimes when there's resource limitation, you tend to adapt. But again, that overall kind of approach more or less is the same. Yeah. Okay. Prashna, any questions, any clarifications before we move to the last part of this webinar? නැත්තම් හැමෝම තේ බොනවද? නැත්තම් නිදිද? Umanga, questions? And Vasana, Sisirath inna, Rikas.
Yeah. Until people come up with their questions, may I ask one from, I don't know whether this is a difficult question or an easy question, so whether I don't know whom to be directed.
Don't worry, if you are in doubt, ask to go in. Never mind, go ahead.
One of the difficult questions that we have faced, well, it's not a difficult question, but
මේ පොඩ්ඩක් ඉන්නවද සිසිර there is a chat saying that they can't unmute, so they have been muted by the system, so they can't ask questions. That is also a good thing to do. I agree. But I think
Chamika will look into that, sir, don't worry. So he will look into that. So while Chamika is doing that, so it's about, now we started with talking about why we do quality assurance in educational practice. So we said that we want to achieve, provide good quality health care to the society. So is there any evidence in the literature that, these two link, whether the quality assurance in educational programs, whether, have actually they improved the quality in healthcare? Is there substantial evidence to support this process?
Okay, so let me ask you one other question, and then probably you can answer, and then I will answer this question. Is there substantial evidence that cutting up bodies in the anatomy dissection room improves quality of surgeons once they are surgeons?
To my knowledge, I haven't.
Right,
Such-
right. But we do, right? Okay. So
Right.
the thing is this, right? So one of the things that that there's no direct link, and still we have not found any direct link between high quality assurance and then the graduates, performing at a very high quality care level. So this is why in the entire system, if you look at mature systems or advanced health professions or medical education systems, you have what we call the program accreditation and also individual competence certification, right? So for example, you certify one's competence, and then of course after 5 years or 6 years you come in and you have to recertify individual competence. Now you have two systems. Now what is being shown is that if you don't have a good quality system, a quality assurance system and an accreditation process for programs, there's a high chance, now that has been shown, that the graduates may not be able to perform well. And I showed you some of the literature earlier. Because the whole purpose of quality assurance and accreditation in health professions is to move, as I mentioned, the curve to the right? So that we see lesser number of people who are unable to practice good quality healthcare. However, that does not guarantee that all of them will be able to provide good quality healthcare. And that's where the individual credentialing and certification comes in. So that's the safety net, right? So unfortunately, there's no link. Right now, there are few actually studies being focused in this particular area. And one of my good friends and colleagues, Professor Janet Grant, she's leading one such group. And also there are a few others who are looking at the link, because one of the things that they were looking earlier, most of our quality assurance programs and or the framework, they were very much focused, they were very much prescriptive, and they were focusing on the processes only, not the outcomes. So they were actually, like, if you look at many of the framework, they were saying that, okay, you must have this many number of lecturers, you must have this many number, the lecture hall should be by this feet, by this feet, you must have this many number of beds in the hospital, etc. Now, while that there's some level of process focus, there's a lot more focus now on outcomes, right? So hopefully in the future, we will be able to see certain outcomes linked directly to the quality framework.
Thank you, sir. So that
Good question. Yeah, very, very good question, Cecilia. Yes, thanks.
Thank you, sir. I think now we have come on. There are a few questions appearing on the chat. I think Vasana will take you through some of those questions.
Sure. Excellent. Thanks, Cecilia. Yeah. Sorry, which one? I can see, how do we develop quality culture? Yeah, so this is from, sorry?
Yeah, you can start answering from that question, sir. Yes.
Yeah, how do we develop quality culture? Again, I think this is from my friend, Mr. Vimal. Yeah, it's an extremely important but difficult question to answer, just like what Cicera's question earlier. So a lot depends on the leadership, right? So if the leadership sets right the direction, the framework, the resources necessary, then the rest actually flows through. So I think one of the key is to understand the stakeholders, right? To see what are some of the challenges and some of the difficulties that they are facing, right? And then to see how we can address them so that they can focus on their work, right? So this is a challenge not only in Sri Lanka, but even in a well-resourced place like Singapore. There's always a challenge because like for example, for not only the teachers, but the students, also the trainees, they are also pulled in different directions. all the time. So then it becomes quite a challenge to ensure that they put sufficient rigor into the training. And that's where the leadership comes in. The leadership must be there to provide the necessary resources, etc. So I'll tell you one example and then I will stop. One is that in Singapore, we found that if you ask the hospital-based teachers and clinicians, and even in the medical school or nursing school, to teach, to research, and to provide service, that it's going to be a huge challenge because you can't be jack of all trades and master of none, right? So therefore, the Ministry of Health here, as well as the Ministry of Higher Education, develop different tracks with different incentives and promotional criteria. So now we have in the hospitals a clinician educator, where 40% of the time is need to devote for teaching and developing teaching, innovation, teaching, research, researching into education, developing new innovations, etc. in teaching, right? So clinician educators in medicine, nursing, pharmacy, allied health, you have a separate track of what we call the clinician educators. Then we also have clinician researchers in the hospital setting. Forget about the universities because they are supposed to do research anyway. So, but in the hospital, you have clinician researchers. So 40% of the time, they must engage in translational research and produce good research outputs. And then you have master clinicians. So 80% of the time, they are at the top level of providing clinical services. They need to spearhead new techniques in surgical procedures, etc. And 20% of the time, they can devote to either teaching or 10% teaching and 10% research. So you need to develop that resources. Then automatically, the teaching culture, the research culture, the service culture gets embedded, right? So that's one simple example how you need to incentivize from whatever the pool of people that you got, you actually focus on those things. So it is the same in the university. We have an educator track, we have a researcher track, and then we have also practitioner track, right? So likewise, that's one way that you develop that teaching culture or the culture in the institution. Gominda, anything to add on? Gominda, you are muted.
Sorry. Now, I think cultures don't get set in overnight. So one of the ways for that to happen is to have some stipulations, like what Dujipa just now mentioned. So if you have stipulations and if all people follow them over a long period of time, then it becomes a tradition and then it becomes a culture. Even without those stipulations, people will do it. But to start with, if you want certain things to happen in a certain way, you will have to have monohari rules and regulations ටිකක් ඕනේ. නැත්තම් අපි ඔක්කොම කැමති අර පරණ විදිහට වැඩ කරන්නනේ. අපිට set pattern එකක් තියෙනවානේ. ඒ set pattern එකට අපි කවුරුත් කැමතියි. නමුත් ඒක නෙවෙයි නම් ඕනේ ආයතනයකට. ආයතනයේ මොන හරි rules ටිකක් දෙන්න ඕනේ. දීලා ඒක ඒවා අපි follow කරනවාද කියලා බලන්න වෙනවා. නැත්තම් අපි යන්නේ අර set. That's human behavior.
So Gominda, just to add on, yeah, so that monitoring is important. එතකොට ඒවා කරන සහ ඒවා ඉතාමත් හොඳින් කරන කට්ටියට incentives වැඩි. මෙහි තියෙනවා මේ යුනිවර්සිටි එකේ ඒ වගේම මේ hospital එකේ තමන් ඒ වගේ ඒවා හොඳට කරනවා නම් තමන්ගේ track එකේ bonus දෙනවා. So ඒ bonus එක තමන්ගේ EX bonus එකක් හම්බුනොත් තමන්ගේ අවුරුද්දම salary එක bonus එකට හම්බ වෙනවා. So ඒතර තවත් incentivize වෙනවා. එතකොට හොඳට කරන්නේ නැත්නම් either education research or other track එකේ අවුරුදු දෙකක් කල් දෙනවා. අවුරුදු දෙකකට පස්සේ කියනවා right ටටා ඔයා එහෙනම් වෙන job එකක් හොයාගන්න කියලා. එතකොට මෙහි ඉන්නවා ඔයගොල්ලෝ Google කරලා බලන්න the world's most educated taxi driver. ඒ සිංගප්පූරුවේ වල. මොකද එයා he was a professor of biochemistry and he failed miserably and he did not listen, he did not this thing, and he became a taxi driver. So you just Google and find out world's famous taxi driver. He has his PhD from Stanford, and he has a H index. I think none of the Sri Lankan or even half of the world has a close to H index. He couldn't find a job, and then finally he went back to China to find a job in the academia, small university. But in Singapore, that's the thing. So if you're not working, you are out. So culture එකත් එහෙමයි. Culture එක build වෙන්න අර ගෝමෙන්දක වගේ ටික කාලයක් යනවා. ඒකට හරි framework එකක් දෙන්න ඕනේ, resources දෙන්න ඕනේ, incentives තියෙන්න ඕනේ. ඒක ටික කාලයක් කරනකොට oversight එකක් එක්ක ඒක ඉබේම ඇඟටම පුරුදු වෙනවා. Right? And සමහර විට තට්ටෙත් යනවා මගේ වගේ. Okay. So ඊළඟට මොකද්ද ඊළඟ ප්‍රශ්නේ? I think
there is another question, sir. It's regarding SLQF level. So what is the diploma, the SLQF level?
වාසනා තව එකක් තියෙනවා කෝසල අහන්න.
Yes, that's what I wanted to. I thought there was a connection problem. I think it's mainly comment about collection of evidence when we are doing. I mean, we need to show that our program is we are assuring the quality of a program, especially in internal review and the external review. We need to collect all these evidences. So, so that is how to do it. And
a lot of paperwork කියන complaint එක
yes, yeah.
So no, true. So I mean වැඩ ටිකක් වැඩි වෙනවා. ඒ කියන්නේ වැඩ අඩු වෙන එක බුරු කියන්න ඕනේ නේ. මේක quality assurance system එකක් දැම්ම වැඩ ටිකක් වැඩි වෙනවා. But the important thing is that we need to look at using our IT and various other infrastructure. We have to make these processes, we have to streamline, right? So then feedback collect කරන එක. ඒක දැන් අපේ දැන් මෙහෙ ගත්තොත් එමේ ඒ ඔක්කොම online automatically collect වෙනවා. එතකොට online ඒවා automatically evaluate වෙනවා. කවුරු කාටවත් ගිහලා එකතු කරලා බෙදලා මේව කරන්න ඕනේ. ඒවා automatically වෙනවා. එතකොට exam systems ඔක්කොම exam soft එකේ තියෙනවා final analysis එක විතරයි මේ human මේකකින් එන්නේ. ඉතින් එතකොට we need to see how much of things we can streamline. How can we make it part and parcel of the day in and day out processes so that you don't have to do it extra. However, having said that, there's going to be little bit more work. And of course, you have to have few more head counts, extra head counts. Then අපේ වෙනමම තියෙනවා මේ medical faculty එකේ වෙනමම තියෙනවා dean's office එකේ වෙනමම division එකක් මේ quality assurance and improvement process. ඒකට යටතේ තියෙනවා exam audits, මේ student audits, මේ teaching performance audits. ඉතින් ඒ වගේ audit teams තියෙනවා. ඉතින් ඒ audit teams උත් දැන් අපි මේ IT use කරලා bots දාලා ඒ bots වලින් ඒගොල්ලෝ ඒවා audits කරනවා exam system errors ඒවා මේව හොයනවා. ඉතින් ඒක නිසා you can streamline a lot. However, it requires little bit more work, little bit more resources. ඒකේ වැදගත්කම ගැන මම දැන් ඊළඟට කියන්නම් ඊළඟ විනාඩි 10යි.
The other question about SLQF level. So what is the level of diploma? What is the SLQF level diplomas offered by ETNR?
පොඩ්ඩක් ඒක මම මේකට මට බොහොම කෙටි උත්තරයක් දෙන්න ඕනේ. One thing to remember is the qualification framework is not a quality assurance framework. So a qualification framework in any country will classify the qualifications they offer. In that country, the different institutes, various qualifications they offer, qualification framework will classify. It's not, so many people think that, well, SLQF can be used for quality assurance purposes, but the document itself is not a quality assurance document. It's a qualification framework. All the qualifications that the country offers will be listed there and will be classified. So එකක් ඊට පස්සේ අහන්නේ මේ diploma has two levels, level 3 or level 4. Level 3 කියන්නේ normal diploma, higher diploma, level 4. So that's it.
Thank you. I think you can continue the other part of the.
Okay. Okay, I think there was one direct question to me, but I don't know how to answer that. In Sri Lanka, we have councils, but we don't have quality assessment or evaluation systems as far as I know. Gominda, do you know how to respond?
Medical Council is setting up one. To be honest, Medical Council had one. I mean, even in the past, they have been doing it, but they have been doing it in a very irregular way. So there were certain periods of time that they did not do this across the board. But now they will have to do it, because now that's where the rest of the world goes. So now they are setting it up in a more regular way. Medical Council, but I can't, I don't know, because Nursing Council is anyway very young. I mean, it is not more than a few years old. I'm not sure what is the situation there.
So one of the things, especially for Nursing Council, pharmacy, all the standards framework, the Singapore Nursing Council, Singapore Pharmacy Council, the framework for training, both the undergraduate as well as postgraduate, it is there, it is online. So if you want to, you can just do a Google, you can go to our Ministry of Health website and you can download those framework for training, undergraduate, postgraduate, and in-service training frameworks for nursing, pharmacy, and allied health, different allied health. Okay, so that's a good question, good segue to come to this part. Why quality assurance in health professions? What is happening, and why are we talking about it? Why is this very important to a country like Sri Lanka now? So the focus is that I will share what is happening around the world, globally, and within the region, and what probably we as a small country in South Asia, why we need to be aware of this and why we need to get our things in place. So the first is that quality assurance is being in health professions education is being really seriously looked at internationally. So at a global level, there are three things that I will focus on. One is what we call the Bologna Declaration of EU Mobility for Professionals, the ASEAN Charter, which was developed in 2018, and of course, for medical professionals, the ECFMG guidelines to practice medicine or to train in US by 2023. So first of all, what is accreditation? So accreditation is that there is a common consensus which started with the WHO in 2016 under their global strategy for human resources for health, that by 2030, workforce 2030, by 2020, it's last year, that all countries will have established accreditation mechanisms for health training institutions. Now, this was taken in 2016. It's already passed. I think they have pushed this by another 4 years to 2024. Similarly, the ACGME has pushed it back to 2025. That's what I understand. That by 2030, all programs, සියලුම ලෝකයේ තියෙන recognized medical, nursing, physiotherapy, pharmacy, ඔක්කොම allied health programs must have established accreditation system, right? So that was one thing, and many of the countries are now have established or working towards that. So these guidelines were the basis of those decisions, and then especially the IMRA, or what we call the International Association of Medical Regulatory Authorities, also took this on board, right? So for medicine, this is even more important. This is even more critical, especially. So what happened? I'll first focus on the Bologna Declaration. Bologna Declaration කියන්නේ European Union එක ඒ ටික ඔක්කොම එක්ක වුණාම, including UK දැන් Brexit එකෙන් අයින් වුණා. ඒගොල්ලෝ they took a decision that ඕනම professional කෙනෙක් එක EU රටකින් graduate වුණාම ඒගොල්ලොන්ගේ accredited program එකකින් එයාට කිසි බාධාවකින් තොරව another EU රටකට ගිහිල්ලා එයාගේ profession එක practice කරන්න පුළුවන් වෙන්න ඕනේ කියලා. So මේක දැම්මහම මේක පටන් ගත්තේ මම හිතන්නේ 2003 නැත්නම් 2008ත් ඉස්සෙල්ලා මට මතක නැහැ.
2009 ගණන් වලනේ.
1990 මේක ගත්තහම විශේෂයෙන්ම medical, nursing and other allied health professionals including pharmacy, they decided that they have to have some common accreditation system or process. So ඒගොල්ලෝ කරේ වැඩේ මේ accreditation systems establish කළා ඒ හැම රටකම ඔක්කොම health professional programs වල යම්කිසි standard එකක්, so that they are now there's a certain level of satisfaction that more or less all the programs, whether they are coming from the former Eastern European countries or like Poland වලින් ආවත් Germany වලින් ආවත් UK වලින් ආවත් ඒ standards ටික යම්කිසි common standards ටිකක් achieve කරන්න පුළුවන් කියලා. So then this may the European Quality Assurance Agency for Higher Education, they had a special for health professions, and they looked at quality assurance, competitiveness, because the courses are also competing with each other, focus on innovation, focus on sustainability, and also internationalization, right? So මොකද දැන් දොස්තර කෙනෙක් graduate වුණොත් එහෙම ප්‍රංශෙන් එයාට ඉංගලන්තයට ගිහලා practice කරන්න පුළුවන් වෙනවා Brexit වලට ඉස්සෙල්ලා, right? එහෙම නැත්නම් ජර්මනි වලින් graduate වුණොත් එයාට බෙල්ජියම් වලට ගිහලා practice කරන්න පුළුවන් වෙන්න ඕනේ. තව ටෙස්ට් කරන්නේ, තව මේව කරන්නේ නැතුව එකම දේ ඒ රටේ මේ භාෂාව ඉගෙන ගන්න ඕනේ. එච්චරයි. ඒක විතරයි තියෙන්නේ එකම මේ ටෙස්ට් එක. Right? So this was actually taken as a part of a decision. So because of that, there was a lot of migration of health professionals, doctors, nurses, physiotherapists, pharmacists, etc. across, and they ensured certain standards. And then what happened was that the ASEAN countries කියන්නේ අග්නිදික ආසියාතික රටවල් ටික සිංගප්පූරුව, බ්‍රූනයි, මැලේසියා, Philippines, Vietnam, Burma, Myanmar, Laos, Cambodia, and Indonesia. They also had something very similar to European Union, the ASEAN Charter, right? And now they also in 2013 passed a very similar bill. So now we are working, because I'm part of this team, we are working with the European Union to ensure that we have a similar set of standards, and actually we have now implemented it. 3 countries have agreed: Indonesia, Philippines, and Malaysia. They have already piloted it, and they are implementing it phase by phase, right? So a very similar thing. Now me හැම එකකටම basic එක තමයි, so this was when they signed this charter by all the presidents of the ASEAN countries. Again, that they are making sure that all the countries in medicine, nursing, and allied health, the professionals, they have this accreditation process established in their own countries, right? And then there's a common standard at a higher level, ASEAN and EU level. ASEAN accreditation standards, so EU standards, so then harmonize කරන්න බලනවා. ඒක තමයි මේ share program එකේ මම මේ ඉස්සෙල්ලා පෙන්නුවා share program එකේ කරන්නේ, so that there is harmonization globally, right? So you can see that there's a lot of work here. And then the medical schools actually got together. This was in 2014, the top medical schools in the ASEAN countries, and we have the working committee, and then we started doing work. So when you say work, it is poor person like me who is doing some of the work, right? So the focus is to harmonize good practices across curricula to ensure graduates are competent so that they can be certified by their own certifying authorities. And then all the countries in this collective have a common and a shared frame of mind. What standards that these or what competencies that these people are able to do based on the common framework or the standards, right? So that this will actually help in mobility of professionals across boundaries for both training and practice. Now, the important thing is that these countries are taking the measure that not even for training, a person can come from another country if they don't have an accreditation system or a process. ඒ කියන්නේ මේ අඩු ගානේ නිකන් මේ training program එකකටවත් එන්න බැරි වෙනවා මේ වගේ standard එකක් ඒ රටේ මේ establish කරලා නැත්තම් in the future 2025න් පස්සේ, right? So that's becoming very important because both European Union, ASEAN and North American countries and also Asia Pacific countries are coming to this shared agreement, right? So if you take example as medical education, so the medical education accreditation and certification actually ensures this process. So I'm not going to go through all this, but basically we have gone a step further. And what we have done is that we have also shared that, okay, but how do you ensure that within medical education, all these processes, whether the accrediting agencies following good practices. So then මං පෙන්වන ඉස්සලා quality control, quality management, quality assurance කරන්නේ accrediting agencies. හැබැයි accrediting agencies in medicine, are they following good practices? මොකද ගොඩක් තැන්වල කියලා තියෙනවා සමහර accrediting agencies minister කියනකොට මේක කරපන් කියලා ඒක කරනවා. එහෙම නැත්නම් කවුරු හරි එක්කෙනෙක් කියලා කිව්වා මේක කරපන් කියලා ඒක accredit කරනවා. එතකොට they are not good practices. So how do we ensure that? That's where some agencies have said that you need to get recognized by the World Federation of Medical Education, WFME. So WFME have this recognition program where they recognize good practices and give the recognition program to an accrediting agency and to say that that accrediting agency is an independent agency. They have good practices, therefore they are quite okay. And then some countries like US and increasingly Canada will join, and some European Union countries and Australia and New Zealand, they are going to say that unless that accrediting agency has that recognition from either WFME or similar international organization like WHO, WFME, and other IMRA වගේ organization එකකින් recognition නැත්නම් ඒත් ඒගොල්ලෝ මේ training වලටවත් කට්ටියව ගන්නෙ නැහැ in the future කියලා. US has established by 2024, they may postpone it, 2023, they may postpone it little later, that they are going to implement this policy for all people coming into United States, right? So I think that's 2023 mandate, right? So the global mark of recognition has ensured that there is enough proper practices that are put in place. So you can see that globally for medicine, nursing, pharmacy, physiotherapy, මේ ටික තමයි ඉස්සෙල්ලම, that they are establishing accreditation based on good standards to harmonize migration of professionals for training as well as for practice. So it is becoming important that we also focus on these areas and develop our own systems and processes, because we can't be linde inna madiyo wage wenna bෑ. Because while we improve our own systems, we need to align with the global trends, right? එහෙම නැත්නම් not now, I mean for us it's okay, තව අවුරුදු කීපයකින් අපි retire වෙයි, but ඊට පස්සේ අපේ එන generations වලට they will not have the opportunity to engage and to work with a much globalized world, right? To get training as well as to go and practice, or to get other people to come to their own countries and to practice as well. So these are some examples. Already I see these many places are aligning. Pakistan has already got the recognition status, and I do know that India is working hard to get their recognition status as well. So even in the South Asia, unfortunately South Asia is so fighting with each other and we are not agreeing, unlike ASEAN I can see there's a lot of agreement and collectively coming together, but SAARC countries I don't see that thing happening. But individually the SAARC countries like Pakistan, Nepal, I'm not sure Nepal, Gominda, Nepal recognized that? I'm not sure.
Not to my knowledge.
So India, Ratawal, them already, and Bangladesh, they are also putting in as well. They are individually setting their standards for medical, nursing and other things, and also getting higher recognition from international bodies as well. So I think that's basically my last slide. I think there will be a few questions, but I want to finally echo what William A. Foster, the head of Quality Assurance Agency for Higher Education in UK said. Quality is never an accident. It is always the result of high intention, sincere effort, intelligent direction, and skillful execution, and it represents the wise choice of many alternatives. So in summary, I think quality assurance in health professions education is basically is to offer and provide to students at least a clear purpose, carefully designed structure, well-managed organization, and is carried out in a way that makes the best use of everybody's time and money. A good quality assurance system is not a policing activity, but an integral part of professional approach to what is, after all, a professional endeavor. And it is a good QA system to ensure the graduates are safe to patients, to team, and to oneself by making competent to deliver quality healthcare. So that's my last slide, and I really enjoyed myself. So I'm sure that there will be few other questions. Do we have any time? We are over 5 minutes past time. So I'm not sure. I'll leave it to Vasana. And thank you very much. Thank you, Govinda.
Thank you, Dujipa.
I think it's okay to take a few minutes for questions. I think participants can unmute their mic and ask the questions, or you can chat through the chat.
I think most of the questions were asked during the intervening time that we gave, probably.
Yeah. I think everyone. Oh, they can't unmute. I thought they were all waiting to go for tea.
Dr. Chamika, can you?
Okay. Yeah, you can type if there's anything.
Yes.
Okay.
Apparently, they can unmute also. So it's not a technical problem that we see. So perhaps you have given
local problem. Is it?
No, you have given a comprehensive account so that they don't have much questions.
Or they did not understand.
There is
there is one question.
Yes.
Yeah, there is a problem with the muting, unmuting.
Yeah, but our technical team informs me that they should be able to, but anyway.
Okay, so what's the question? Sorry, I can't see.
It's from Rikas. It's about, you mentioned about, yes, about automation methods for quality assurance. Can you give some examples?
Okay, so the example that I gave is in exam audit, right? So let me try to see whether I can get that going. If I can show you. So one of the things is that so I'm actually I lead the medical school's quality assurance team, or the continuous quality improvement team, and one of the things that we have to do as part of quality assurance is to do exam audits. So, oops, sorry. Okay, sorry. This is okay. Let me mute that first. So we have to do exam audits, right? So what we do is that we actually audit all the exams in the medical school, and there's a process where we audit both the undergraduate programs, the nursing undergraduate programs, because nursing school is also under us, the life sciences modules, which is also under the medical school, and also the postgraduate residency programs, the Master of Medicine, some programs. So previously, this was done manually, and it takes a lot of time to do manually to evaluate this. So what we have done is that my team has developed an automated system. So this actually this short video will show you how we have automated this process. Sorry, Vasana, can you hear?
Yes, yes,
Yes,
yes,
we can hear.
So that's a clear example of how you automate, right? So very manual exam audit process where we had to audit more than 200 or 250 exams and processes. We have completely automated it. 90% is automated now using a low code, very easy, what is available in Microsoft suite, a process that that can be used. So again, so that has really left a lot of us and our faculty members and also our administrators time to focus on other things. So likewise, I think you need to, once you start doing the process, you need to identify what are the areas that you can actually streamline and automate. So that's one example. So likewise, we have many such processes now in place. We have dashboards which collect information. We are now developed data lakes where all the data gets ported in. We can track students from the time of admission until they graduate, how they perform in exams, etc. Right, and then project which ones that they are doing well and which ones they are not doing well. And some of this actually Gominda helped us. Gominda was with us, so you have all the resources there. Actually, if you use it properly. So Gominda is the one who really helped us in improving our exam systems and processes and also helping us in automation. Sorry, I don't know whether it was a long-winded one, but just one example.
Thank you, sir. And there's another question in the chat. It's about accreditation of nursing. They're asking about how to, are there any accreditation bodies to accredit nursing programs in Sri Lanka?
Gomind, I don't know.
Well, I mean, I'm also not very, but if nursing council is like the SLMC, then they should accredit the nursing programs there. If it is like, I haven't seen the act and the documents to concretely say anything, but if the nursing council is like the Sri Lanka Medical Council, it will have to do the accreditation.
Excuse me, it's me, Umanga.
Yes.
And at last, okay. And the SLMC and
Yeah.
how it can be an accreditation body, since that there will be a conflict of interest because they are the people who are registering our people, and likewise this autonomy accreditation body. So in that case, it should be out of SLMC even, isn't it?
It is like this. Now, the registration is done on the basis of accreditation. So if a medical school is not accredited, their graduates will not be registered.
Okay.
Right? But that's one thing. But you are right to an extent. So that's why SLMC has now set up a separate accreditation unit which is independent.
Yeah.
And the SLMC council can't change the decisions of that unit because that is needed for WFME recognition. They don't want anybody interfering with, it should be an independent council, independent agency. So therefore, the SLMC has set up a separate agency called the accreditation unit.
So that's mean that we are now for that, isn't it? Now, years that all of you are trying your level best to get established some sort of accreditation system, at least for the medical education, isn't it?
Yeah.
And the same accreditation body is going to apply their rules and regulations for the other health professions that who are to be registered in the SLMC.
No. Those are being done by the Sri Lanka Medical College Council.
Accreditation.
Sorry.
The recognition accreditation. Yeah, Dujip.
So there are two things here, right? I think this is where sometimes people get confused. There's accreditation of a program and then certifying of a professional. Now these are two different things, and in some places it happens in two different places. For example, let's take South Korea or Taiwan or even Malaysia and even in Singapore. Now the program is accredited by, let's say, by the in Taiwan. This is a good example in Taiwan, by TAME, Taiwan Association for Medical Education, which has been given the statutory power by the government to accredit medical programs and also to allow or disallow new programs or the existing programs from continuing. So they look at the standards of the program. But once the graduate graduates from the program, the graduate needs to get certification, registered and certified, right? Now that is done by the Taiwan Medical Council, right? So the Taiwan Medical Council looks at the particular person, and then based on the qualifications obtained, the practice level reports from the supervisors, they give the provisional or the full registration, and then of course subsequent re-registration or recertification for that person. In some places, both are done by the same, but different divisions. Like for example, General Medical Council, right? The General Medical Council, they have for medical schools a separate division. They have for individual medical professionals, medical practitioners, a separate division. But it is within the same council. So there are different ways of doing things. And based on socio-political environments, things have developed in different ways in different places. Yeah, but it's two different things. Am I clear, Umanga? I'm not sure whether you got it.
Yeah, no, it's clear. I mean, now the even Taiwan system is almost like the same that's going to be in here. SLMC is separate and accreditation body is to be a separate one for us, it seems.
Yes, but it is within the council. Same, yeah, like the GMC model.
Yeah, the other thing now I was wondering now, since after going through all these 2-hour sessions with both of you, and some gray areas are getting clear for me now, since we are now planning to actually initiate what that we have done and with your all of your assistance the next year about the national standard. And as I think repeatedly, Professor Govind is telling it to me that it's a more or less a quality assurance tool, isn't it? What we are having. Time in. And since it's an initiation and for the first time we are going to do it, so I thought of it's going to be in a more simple level. In automatically, then as you said that the culture will be happen in the 4 or 5 years time. Now even in our higher education system, now they have gone, I think 2 or 3 rounds, isn't it?
At least 2 rounds, yeah.
2 rounds, so that the culture is still now developing. So that is it, and I'm happy at least that our people are here, participated, and this is a very good sensitization program for them about it. And actually, I was not able to invite the SLMC as well because there are my friends there, and if they came here, they will understand some of the other aspects that even the health ministry is facing, and likewise. Anyway, thank you very much for both of you, really, Dr. Gominda and Professor Gominda and Dr. Dujipa. I'm really grateful to both of you, and both of you. You are always with us for years and years. And I still can remember, Dr. Dujipa, you asked me to dream and not to stop it. And I was there at a time that thinking that now I have to stop it. But you said, no, you have to still dream. Now still I'm dreaming. And
You need to dream.
Yeah, thank you. And
keep dreaming, Umanga, and keep making tea.
Yes, of course. Now I'm going to dream on that.
All right. Okay. Thank you very much, everybody.
Thank you.
It was really nice meeting all of you. But you have my email. If you need anything, you just drop an email or talk to Gominda, and he will link me up with you. Thank you very much.
Thank you.
Thank you.
Thank you very much. And if possible, and there is another comment from chat box, please share the automation methods, more information about automation methods. I think the Rikas can email.
Sure.
Yes, Rikas can email Dr. Dujipa to get more information about automation methods. And so I think yeah, there are no other questions. And so I want to thank both Dr. Dujipa Samarasekara and Professor Gominda Ponnamperuma. And I think from the beginning, it was a very engaging session, and it was very comprehensive from the concept of quality to the future focus of future quality assurance was done, and it was really comprehensive. And I think we learned, you all learned about quality system, this quality control, quality management, and quality assurance, all these 3 categories. So I hope you learned a lot. So thank you very much for accepting our invitation. And also I want to take this opportunity to invite you for the next webinar. That will be the last webinar, especially organized for Ministry of Health staff. That will be on 13th October, in 2 days time. And Dr. Umanga will circulate Zoom link today evening. So please register for that. And also our main conference is scheduled on 19th and 20th November. It will be a fully online event, and there will be a post-conference symposium on 25th. And also, in addition to that, you can participate for pre-conference regional workshops. There will be more than 5, I think, 5 to 6 pre-conference regional workshops organized by different medical faculties around the Sri Lanka. So please participate for that as well. And if you want, please visit our website, conference website, that is colombocme.org. And so we all we invite you all for our main conference and pre-conference regional workshops. And we want to see you all there. So thank you very much, and have a pleasant evening. So thank you.
Bye-bye, everybody.